Israeli engineers developed implants to help paralyzed people walk again, and it's with 3D spinal cord tissue. It's a world's first. They've been having a lot of success in spinal cord assistance. Now this is a new study from Tel Aviv University, sees the successful engineering of the world's first 3D human spinal cord tissues. And this is by Shira Silkoff on Jerusalem Post, published just today. This is amazing development in the medical field. People with long-term paralysis might regain the ability to walk after Israeli scientists successfully engineered the first 3D human spinal cord tissue. The results published in a groundbreaking peer-reviewed study published in the journal Advanced Science this morning. The study, conducted by researchers from Sagol Center for Regenerative Biotechnology at Tel Aviv University, headed by Professor Tal Dvir. He was joined by researchers from Shmunis School of Biomedicine and Cancer Research and the Department of Biomedical Engineering at TAW. The team at Dvir's lab include PhD student Lior Wertheim, Dr. Reuven Edry, and Dr. Yona Goldschmidt. They have not been able to heal spinal cord injuries. Why have they not been able to heal spinal cord injuries? ? Paralysis may occur after a spinal cord injury. It can refer to damage sustained to any part of the spinal cord or the nerves at the end of the spinal cord, as we can understand. That's critical. These injuries can cause permanent changes in strength, sensation, and other bodily functions, and in severe cases can lead to long-term paralysis, for which there is currently no cure. But despite many prior attempts having been made worldwide to promote natural or intervened generation at the site of the injury, there has been minimal success. Now, many existing experimental or investigative methods rely on transplantation of different cells or biomaterials into the site of the injury. Two issues jeopardize the success of the treatment, but the immune response to the transplanted cells, causing them to be rejected, and the implantation of dissociated cells that fail to form into a functional network. So a research team hypothesized that mimicking embryonic development by applying specific spinal cord motor neuron differentiation protocol in a 3D dynamic environment would provide cells with signals for appropriate regenerative tissue information, healing the site and lowering the risk of rejection. Finally, support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box. So they theorized assembling a functional neuron network prior to implantation would increase the chances of functioning engraftment, in which it integrates well into the host body. The procedure was developed by the research team. It involved taking a small fatty tissue biopsy from the patient. It separated it into cells and the extracellular biomaterial. The cells would then be reprogrammed to become patient-specific induced stem cells, pluripotent stem cells, a cell type used in regenerative medicine that can propagate indefinitely and can be used to replace cells lost to damage or disease. This is extraordinarily, unbelievably significant. They're using the patient's own cells, creating a specific type of stem cell that would regenerate and replace the damaged and diseased cells. You can understand what this means for people, even with perhaps nerve damage, even with, for example, MS. Now, meanwhile, the biomaterial undergoes a process to turn it into personalized hydrogel, into which the embryonic-like iPSC cells are encapsulated, allowing them to differentiate into 3D spinal cord network. Not only does the biomaterial turn hydrogel support the cells, the study explained, but also constantly adapts and develops, thereby providing a dynamic, inductive microenvironment allowing for the assembly and maturation of a functional spinal cord implant. Following the successful mimicking of embryonic spinal cord development and the engineering of functional tissue implants, the researchers moved to test the therapeutic potential of these 3D spinal cord networks, choosing to use mice as a testing model. The mice were divided into two groups, those who had been recently paralyzed and those who had been paralyzed for at least a year, in human terms, chronic. The mice with acute paralyzation regained the ability to walk within space of 3 months after the insertion of the implant, showing significant gains over mice with acute paralysis had been left untreated, while the untreated mice did regain partial motor function over time. They showed worse coordination and a greatly decreased ability to place pressure on the injured foot. So following the success observed in the acute phase of injury, the research team moved on testing the same theory in the mice with chronic paralyzation, more clinically relevant model due to extent of permanent damage on their spinal cord. And in 6 weeks after implantation, the artificial spinal cord into the mice with chronic paralyzation, the animals showed improvement significant, indicating that the implant has successfully been integrated in the body. Overall, 80% of the mice in the test group regained the ability to walk. So following the success of lab trials and results observed in mice, post-implantation, researchers hope to progress to clinical trials in humans within the next few years. They've already held talks with the FDA regarding this preclinical program. Amazing. So how could this impact the field of medicine? You can imagine. While the study specifically focused on injured spinal cords, the researchers hope the future of the same technology could apply used to treat a variety of different diseases and injuries such as Parkinson's, brain trauma, myocardial infarction, age-related macular degeneration, all of which they are currently researching through this technology. DeVere says there are millions of people around the world who are paralyzed due to spinal injury, and there is still no effective treatment for their condition. So individuals, he said, injured at a very young age are destined to sit in a wheelchair for the rest of their lives, bearing social, financial, health-related costs of paralysis. Our goal is to produce personalized spinal cord implants for every paralyzed person, enabling regeneration of the damaged tissue with no risk of rejection. Unbelievable. Unbelievable. This is amazing. It's just fantastic. Congratulations to them. This is by University Hospital Samson Ostuta Ashdod on the Jerusalem Press. Please leave your comments and thank you for your support.